Welcome back to Did You Know, a podcast by Partner Veterinary. In this series, we dive into everything veterinary medicine and everything partner. In each episode, we tackle some of the most common questions we hear, from HR to emergencies and everything in between. If it happens at Partner, we'll talk about it. So your cat is stumbling, or your dog won't stop tilting their head. Maybe your pet suddenly can't use their back legs. Something is off. This is when your primary care veterinarian may suggest seeing a veterinary neurologist. In this episode, Dr. Ryan Gallagher, veterinary neurologist at our Frederick location, pulls back the curtain on one of veterinary medicine's most specialized fields, breaking down what a neurological exam actually looks like, when an MRI or CT scan is the right call, and why a referral to a specialist might be the most important step in your pet's care. Whether you just got that referral or you're simply curious, this one's for you.
So my name is Ryan Gallagher, neurologist here at Partner Veterinary Emergency and Specialty. As far as how I got into veterinary medicine, didn't have like the childhood dream of being a veterinarian. Through high school into undergraduate, I kind of gravitated towards the sciences. So I knew I liked the life sciences, as I think many of us do. I actually started by volunteering at a veterinary hospital when I was in my undergraduate years, and I kind of loved the experience, both the medicine, connections with people. And I kind of worked my way up, sort of the ladder, if you will, from volunteer to became a veterinary technician, eventually a veterinary student, young veterinarian, intern, right to a residency, to specialist. And it was kind of during my vet schooling years that I kind of gravitated towards, sort of the neurology side of things. So yeah, it's been a pretty long road about, I would say from start to today, about 30 years. Been in the industry at various levels, and been a practicing neurologist here in Maryland for the past 11 years. 11 years? No, longer. It's been since 2011, so 14 years.
Okay. Time goes quickly, doesn't it?
Yeah. Time flies. Yeah.
It does. What brought you to Partner, Dr. Gallagher?
Really meeting everyone there. The fact that the team at Partner from top to bottom, everybody has tons of experience in the industry. And our management team has been pretty much from client services, from the technical aspects to practice management, have a ton of experience in all aspects. And I kind of feel like that has allowed them to have a pretty unique perspective, rather than just like a business management, sort of take on things, on just knowing what we need, for support.
They've done the job before, and they've been in each of the team's shoes, so they really do understand.
Exactly.
Can you explain to us what the role of a veterinary neurologist is?
Yeah, absolutely. It gets, pretty confusing with all the different specialties. So neurologists, they are veterinarians, of course, that have gone beyond veterinary school, have done additional training to gain expertise and like diagnosis and treatment for conditions affecting various parts of the nervous system. And that means, sort of conditions affecting the brain, spinal cord, peripheral nervous system, neuromuscular junction, basically how all those things connect together. In the clinic, that kind of means consulting with these patients that are suspected of having neurological issues, localizing exactly where in the nervous system the problem is, diagnosing and really figuring out, not just what's going on, but what are our treatment options, and implementing that treatment plan.
What is the difference between a neuro exam and a regular physical exam that pets receive at primary care vets?
General physical exams, they're pretty much trying to encompass everything, not just the nervous system, but also, cardiovascular, respiratory, gastrointestinal. It's essentially casting a very wide net to try and figure out what's going on. Often as part of that general physical, we may have a suspicion of a neurological issue. And the neuro exam, that's kind of a more in-depth dive into, testing specific functions. So we're really screening, not just general mentation, but specific reflexes, cranial nerves, coordination, screening for pain. So it's just I would say an expansion of the general physical exam that gives us quite a bit more information about what's going on with the nervous system.
What kind of information do we get from the actual neuro exam?
Yeah. So the goal of the neurological exam, again, that more focused exam, a little bit beyond sort of our general physical, it is essentially if there is a neurological issue, is to help us localize exactly where within the nervous system the problem is, because we do have these, essentially then these nerve pathways mapped out. We kind of know, these reflex arcs, a comprehensive evaluation kind of allows me to identify exactly where the issue is with a fair degree of accuracy. I mean, of course, there's always the patients that don't read the textbooks and can be problem children, but I would say, like, for example, sometimes I'll have patients come in that have a blindness, a visual deficit, no response to visual input. They're bumping into walls. Why? Why are they blind? I mean, this could be due to a ocular issue. It could be an eye issue, problems involving the retina or the lens. This could be a problem with the nerve that carries those impulses, essentially from the retina to the brain. It could be a problem with the brain itself, which is kind of the processing side, of vision. As part of like this evaluation, one of the tests we'll frequently do, or I should say some of the tests we do, is we'll actually test visual input. We'll do this, I'm not going to hit myself, but major flinch, kind of test, can you actually see me coming at you? If not, we'll test some of the ocular reflexes, so like shining a bright light into the eye. Are we seeing pupillary constriction? Are we seeing like involuntary blinking to that bright light response? For example, if I see a patient that's like not visual, they're not, menacing, but shine the bright light in, we're seeing the pupillary constriction. I mean, that tells me a lot of things. It tells me the retina's working. It tells me the optic nerve's working. It also tells me the level of what we call the midbrain, where that reflex, sort of synapses and comes back out to the eye, causes pupillary constriction. That's working, and that kind of tells me that the source of the visual deficit has to be at the level of the visual cortex, the area of the higher, brain, the forebrain that processes vision. And that, if we have patients that present, in that way, well, we know we need an MRI. We don't need to go to the ophthalmologist, so that can be really helpful again for us, localizing exactly where the problem is.
But are there certain neuro problems that you see more often than not in pets today?
Absolutely. And it is very, I mean, sort of interesting the distribution of the caseload that we see. I would say, and this is not reasons not to adopt dogs, my patient population, I mean, yeah, the vast majority are canines. Kitties seem pretty resistant to a lot of the neurological diseases. We see them for sure, but it's probably like 10 to 15% of my caseload, whereas, and unfortunately, if you were to talk to, our internal medicine department, they see a lot of kitties, because they tend to get, cats because they get, more, other organ dysfunctions rather than the nervous system, but a lot of my caseload is canine patients, a lot of our caseload does tend to be either, seizure disorders, that is a really common neurological issue that we tend to see in pets, for a whole variety of reasons, ranging from, this, what we call idiopathic or oftentimes heritable genetic epilepsy, also due to other conditions like inflammatory brain diseases, tumors, what have you. The other, very common condition we tend to see are these mobility issues, due to spinal disease, and there's many causes, which is why we, talk about going down that diagnostic path we talked about earlier. But the things that we see like very frequently would be like intervertebral disc disease, disc degeneration and then herniation, either bulging or in some cases rupture, causing spinal compression. And that can cause, spinal pain, can cause, lameness, weakness, and because often we see that those predilections, disc disease, things like that. Many of my patients, while we talk about really the role of the generalist versus the specialist, many of my patients, they may have undergone like prophylactic, management for suspicion of these different conditions. I mean, which is very reasonable. Common things occur commonly. So a lot of my patients that come in that have back pain, they may not have had advanced imaging, but they've been started on like medications, for medical management for suspected disc disease. And that is very appropriate, but if we're not getting where we need to be with management, I mean, that is when, the specialist steps in, that is when you should seek referral, because if we're not getting where we need to be with less aggressive measures, maybe we do need to consider a more aggressive intervention. Or, I mean, maybe our suspicion is wrong. While common things occur commonly, it's very rare my patients read the textbooks. So maybe we need to figure out exactly what's going on.
And do things seem to be breed specific when it comes to dogs?
There are breed predilections for many conditions, and that is one that we do tend to see. And I think like disc disease is a great example. That something that we see it commonly in all dogs. Honestly, I when I tell owners, that that's sort of on my differential list, that I have suspicions, it's because it's one of the most common conditions we see in the spinal cord of dogs. Whether you're large, small, rotund, skinny, it's just common. But definitely, certain breeds do have a predilection for disc disease. Like a lot of our smaller breeds with longer back, shorter legs, what we call our chondrodystrophic breeds, they're pretty prone. And unfortunately, even at a young age, to developing some of these changes, So yes, as part of when we're talking about our suspicions, I mean, age, breed, that does factor into like our differential list of what we suspect we're dealing with, there essentially. Again, some of the most common presenting complaints, for our back pain dogs, if they're of a certain breed, certain age, we're going to be a lot more suspicious that they're dealing with a disc herniation than perhaps others. Likewise, one of the other more common presenting complaints, if my patient is coming in for seizures, and they're of a breed and of an age that we often will see epilepsy, in. Sometimes that'll affect our not necessarily what we offer. I never feel getting definitive answers is the wrong answer. But how aggressive we are with pursuing advanced diagnostics. Especially if we are of a breed and age that we frequently see idiopathic or this heritable epilepsy in, and especially if they have a family history. I'm a lot more comfortable presumptively managing them as an epileptic rather than going the distance with the diagnostics. If we're not of that kind of age range, if we're not of a breed, if we don't have a family history, I get a lot more concerned, that there's some underlying pathology, and I would be a little bit more emphatic about recommending diagnostics, because I think there's a higher likelihood that we may find something that we can treat.
If people can't afford the advanced diagnostics, is there still value in getting an examination, a neuro examination and consult?
Yeah, I would say there absolutely can be. Yes. I mean, while most general practitioners, I mean, are of course highly trained as far as, both screening for and treating, for certain neurological conditions, there are certain ones where, yeah, we're getting into a little bit of deep water here. The consultation with a specialist, can be pretty helpful, even if we're not looking to do like advanced diagnostics. I think, a good example of that is like difficult to manage epileptics, where we've tried, the option 1, 2, 3, and we're not quite getting where we need to be, or we're, getting control of these, signs. And in that case, referral to an expert can be very helpful for us to fine tune the medical management, and potentially look at other treatment options.
How is the neurological exam performed? What can somebody expect when they come in with their pet?
Generally, when we start the neurological exam, it sort of begins with observation. So looking at the patient's posture, gait, are we seeing, any evidence of like compulsive behaviors? Do they appear to be visual? Then it progresses to a little bit more hands-on evaluation. And that really consists of, testing what we call proprioception, positional awareness of the limbs, are they coordinated, reflex testing, testing these nerve pathways, cranial nerve testing vision, sensory testing, finishing off the exam, but screening them for pain, sort of an in-depth palpation of, well, if we feel like they're uncomfortable, can we localize exactly where it's stemming from?
And how long does it take to do this exam, or does it just vary on the pet?
Yeah, it can vary a bit on pet. It always depends a little bit on their cooperation and
Right.
compliance.
Mhm.
Yeah, my key example of that is like neurologic examination in cats, because we always just have to take what they're willing to give us that day. Generally speaking, though, a pretty detailed neurological exam can be completed within like 10 to 15 minutes.
And if further diagnostics are needed, can you explain, well, first of all, what are those diagnostics? I know we, like at Partner, we have the MRI and the CT scan.
Yeah.
Is that what we're talking about? And then what is the difference between those two?
The diagnostic plan depends a little bit on where we think the problem is, and what structures we think might be involved. Generally speaking, I mean, MRI, CT, they're often, sort of the endpoints. We're often starting prior to jumping to imaging. Depending on again on where we think the problem is, we may be recommending, just starting with casting a wide net. But things as simple as just general health blood work. Screening, like for example, for these, seizure patients, epileptic patients, we want to make sure it's not secondary to like systemic illness, things like liver dysfunction, renal dysfunction. Likewise, for my patients that are having back pain, we may start with x-rays or radiographs, and just make sure there's not something quick and easy that we can pick out, things like a fracture or a tumor involving the bone, that you don't necessarily need to go to the bigger tests, for. I would say oftentimes, blood work, x-rays, they may not give us the definitive answer. And in those cases, we may have to reach for more advanced imaging. Those two tests, that you mentioned, CAT scan or CT scan versus MRI, they're both very good tests. They're both three-dimensional imaging. So you get, really good detail. The difference is, due to the technology, they're good for looking at different tissues. CT scans, they are based on X-ray technology, so similar to X-rays, they're good for looking at bones, but you get much greater detail, So sometimes if we are concerned about bone pathology, but we're not getting answers on X-rays, that can give us a little bit more information. Really, times that I tend to reach more for the CT or CAT scan is usually if we're worried about fractures of really sort of complex structures, such as the skull, if we're dealing with head trauma, if we're worried about, certain types of spinal fractures that are difficult to evaluate radiographically, that, can be a very helpful test. MRI, conversely, is a test that's really good for looking at soft tissues. CT, great for looking at bones, so the weakness or limitation of it, limited soft tissue detail. MRI is beautiful soft tissue detail. So that is a test that, when we are concerned about brain pathology, or spinal cord pathology, that can kind of be our go-to, with that. For the conditions I see, yes, I think MRI is probably 90% of the time, if not more, that the modality we're reaching for, just for the conditions I see, that's kind of where our focus is. Beyond those tests, I mean, there are, sometimes additional tests, imaging sometimes doesn't give us the whole picture. One test that we sometimes do recommend in conjunction with either CT or MRI would be sampling of spinal fluid or spinal tap. That is something that we do. I wouldn't say necessarily for every case, but occasionally, primarily if there's a concern for possible inflammatory diseases affecting either the brain or the spinal cord. MRI, I mentioned, it's great soft tissue detail. The difficulty is for certain conditions, such as inflammation, you may see the inflammation. It doesn't tell you why it's there. So sometimes there's just that additional step, to get all the answer.
What is a fluoroscopy? Is that something that you work with as well?
So actually, I would say that is something, it's a little bit, I would say indicated less frequently for my patients than for certain other conditions. That is it's actually a great study. It is an X-ray study, compared to X-ray or CT, which both, can give you great information about those structures with, high density such as bones, or with a big change in density such as lung fields. Fluoroscopy is actually a live action picture, of an X-ray. So that is one that can be really useful for certain like interventional radiology procedures. So if we're actually trying to map blood flow to certain areas, or a lot of our interventional radiologists, they use that study, for placement of, certain devices, such as stents, things to hold blood vessels or airways open. So that's kind of where that has a big role for our patients. Again, because fluoroscopy, while it has its strengths, limited soft tissue detail. Since I'm usually wanting to look at the brain or the spinal cord, it's a little bit less useful for my patients, albeit it does have its role in select cases.
Will some patients need to have both an MRI and a CT scan?
Well, that is possible. There are certain situations I would say for most of the conditions I see, MRI is kind of the workhorse, because it does give us the greatest soft tissue detail so for a lot of conditions I see, MRI may just give us the answer right there. CT, that also, when there's certain indications where we're talking about like head trauma, skull fractures, CT alone may give us the information we need. If there are complex, fractures or trauma, where we really feel like we need to get a great look at bone itself and the soft tissues, then yes, then occasionally I will recommend both MRI and CT. The other situation I think we sometimes find ourselves in is MRI is used to get the diagnosis. And in this case, that I feel like sometimes we then recommend CT would be in certain cases of tumors or cancers affecting the nervous system. While MRI gives us the answer, and it has great soft tissue detail, spatial resolution with MRI is not quite as good as CT. So sometimes we will follow up with CT. While that doesn't give us quite as good, again, soft tissue detail, spatial resolution is excellent, and certain therapies, such as like radiation therapy, they can require, I mean, you really want to know exactly the bounds of the pathology, so you can precisely target it, and avoid, essentially collateral damage, so that is like the one or two situations that we feel like, yes, we may start with MRI. We may recommend CT, or in the case of trauma, that we might do both at the same time. But that again, I would say is probably the minority of the time, that we're setting people up to embark on both of those tests.
What can pet parents expect when it's time for their pet to either have an MRI or a CT scan? What can they expect to happen?
Both CT and MRI they're completely non-invasive procedures. We're not doing anything, surgically or anything like that. The big constraint for veterinary medicine compared to human medicine, because it's the same machines, as if you went in for a CT or an MRI yourself. I mean, for both of those, they have you lay down, they, shoot you through the tube. The big deal, if you will, is you have to be motionless, and it's hard even for people to do that, especially if you have a touch of the claustrophobia with that. But for our patients, because both CT and MRI, you've got to be motionless for a time. CT relatively short, MRI a bit longer for acquiring those images. Both do require sedation, or in the case of MRI, essentially general anesthesia. That's probably the biggest thing we want people to understand is that they will have to go under anesthesia. It is again what we would consider to be a light plane of anesthesia. We're not doing anything noxious to them. They just need to be motionless. So it's kind of on the level as if they were going in for like a dental cleaning. They go under for a little bit. The general anesthesia, while we would never say anything is no risk, tends to be a fairly low risk proposition for our otherwise healthy patient. As far as, well, is there any situation that we might feel there it's unsafe or that we can't undergo general anesthesia? Really in our patients that have like significant cardiovascular disease or pulmonary disease, that might affect our decision, to proceed. But in most cases, no. It's they take a brief nap, they wake up, we have the images. Some of that additional testing that I mentioned earlier, like if our patients did need something like a spinal tap, well, while that's a very quick procedure, they also have to be motionless. So generally the way we approach it is we're already under. Let's take a look at the MRI or CT, decide if that test is helpful. If so, we just do it quickly while they're still under, and then they recover. They enter recovery from anesthesia because of the anesthesia and the scan time for MRI. The other big thing I'm always trying to make owners aware of is it's not necessarily an in and out sort of procedure. It's not an all day affair, but it's like a half day affair. So for most of our patients that are needing to come in for advanced imaging, they do drop off. I don't necessarily recommend owners wait in the lobby because that's just stressful. Say go do your thing. I'm able to call them as soon as we're getting images, and we have a much better sort of timeline, for when they're going to be awake and ready to come home. It's just one of those things that, we always have to be aware, that those tests do take some time.
Okay. One of my questions was how long does it take? And then how long does it take before an owner can expect to have some answers?
So typically, I mean, while I am not a veterinary radiologist, I would never claim to be an absolute expert in interpretation of these images. Of course, I'm working with them every day. So, typically, when I am making that call, at the tail end of the imaging procedure, I'm going to give them my impressions. I'm going to tell them, well, here is what I think is going on. Of course, we do get the expert opinion as well. So we send all of our imaging out for radiologist review. Once we get that back, which, sometimes that can be within a day, that we get those answers. And then we have another conversation. Here's what it looks like we're dealing with. Depending on whether or not we're waiting for additional test results. Whether it's spinal fluid analysis or biopsy. Sometimes that can take a little bit longer. But essentially, once all these reports trickle back in, then we all get together. We reconnect and come up with an updated sort of treatment plan.
And I guess from there, I mean, every treatment plan is going to just depend on what is found and what is happening with the animal.
Yeah.
Depends on what happens from there.
Exactly. Yeah. So depending on what's going on, I mean, treatment options, I mean, they may vary pretty widely from like medical versus, surgical, management. And that is one of the conversations I frequently have with owners is, well, if we're not inclined to go to an aggressive intervention, like a surgical intervention, is it even worth doing these diagnostics? And in many cases, yes, because depending on what we're dealing with, there may be additional medical management options. Some of those, again, depending on what we're suspicious we might be dealing with, we may be able to implement even before imaging and see if we get a response. But that is something that, I do frequently have conversations with owners about is what is the value of these tests? Where are we going from here? And while we never know, until we get the answers in hand, for sure, some of those options we can explore prior to imaging. Some, we really need the imaging, to really know fully what our options are.
Yeah. And I think when pets are insured, these types of tests are typically covered under insurance. Am I correct about that?
Correct. Yeah. That is something that, and of course, I mean, the insurance industry and veterinary medicine, it's an evolving, sort of process, but yes, typically if there is an indication, which if you're crossing my threshold, my doorway, likely there is, but if there's an indication for running those tests, then yes, they typically are covered, as far as, to what degree and what percentage and all that, that you really have to really inquire with your provider.
What legacy do you hope to leave in the veterinary field?
That's a tough question. That's a lot of pressure. I would say, personally, I mean, as a veterinarian who works on the clinical side of things, I mean, I'm clearly not in the lab researching cures for canine brain cancer. I'm not spearheading the science. What I am doing, and what I want to be doing essentially is applying like latest, evidence-based, scientific recommendations, and allowing our clients to make informed decisions about their pet care. So I want to make sure that not just our area, Frederick, but also all of Maryland, Mid-Atlantic, as a whole, that they have access, that they have access to, excellent care for neurological diseases. We want to help as many animals as we can, but we also want to be able to educate. We want to educate our clients and just make sure that they can make, actually go informed decisions, empower them, to be able to, provide the best care for their pets.
Dr. Gallagher, thank you so much for taking the time to chat with me today.
Absolutely. Thank you, Jen.
Thank you for listening to Did You Know? Is there something about Partner that you want to know? Email us at letstalk@partnervesc.com. Who knows, we might turn your question into an entire episode. You can now find us wherever you listen to all of your other favorite podcasts. Subscribe now.